It's time for the 1430 Connection on 1430 WNAV and 99.9 FM, spotlighting news, newsmakers, and important community issues. Now, with this week's edition of the 1430 Connection, here is WNAV news anchor Donna Cole.
Welcome to the 1430 Connection. I'm Donna Cole. Today I have the pleasure of speaking once again to Joe Addivinola. He's president of the Arundel County Professional Firefighters Local 1563. Joe, thanks for taking some time today to talk to me.
Oh, you're very welcome, Donna. Thanks for having me.
Well, as you are well aware, we're in the midst of this pandemic, and this has not been easy for firefighters. I've spoken to a few of them, a few of our local firefighters, and the two that I've spoken to in recent history both had their own bouts with coronavirus.
Yes. You know, the virus has touched over 60 of our members so far since March. We just had another 13 members test positive since Monday. So, it's been a rough time. It's been definitely a challenge to be a firefighter medic in this COVID-19 pandemic, you know.
In my speaking to the two firefighters that I've spoken to, they, early on in the pandemic, there were not a lot of clear-cut factors in who was presenting that these people could have had COVID and the firefighters, the paramedics could have been exposed to it. As the pandemic went on, it became clear that and you can correct me if I'm wrong, that the pulse oximeter was like the best clue that many of them have.
Yeah, I mean, for the most part, we've definitely done a better job at screening the calls from the beginning, from the 911 call, asking the patients if they have signs and symptoms. So we've done a better job thus far with that. We've taken a lot more precautions with the PPE, and all that, and limiting our members' exposure also. Usually, when we get a call, we have a whole crew go into the house with the patient and, we take it from there. But now, we're kind of like limiting the exposure of many people, many crew members into that person's house because we already have an idea that they may be COVID positive. So we've definitely taken a lot more precautions. But it's been going on for 9 months, It's definitely taken its toll on our members, and even the general public. People get lackadaisical and they let their guard down. And the unfortunate thing is, we can't let our guard down. We can't do that. We have to stay vigilant. We have a goal of keeping the community safe and keeping the spread of the virus at bay. It's a difficult situation.
You said 13 firefighters have tested positive since Monday, and how many members have had it since the start that you're aware of?
Probably close to 60.
How have all of your members that have had it done so far?
Some of them, it was very minor. We've had several. I know you spoke to Brother Holtzlander. He was pretty sick.
Yep.
A couple of people had to be hospitalized. They couldn't get their symptoms under control. But everybody thus far that it has affected them very seriously, they're back on the job and working. That's a good thing.
That's a great thing, knock on wood. Now, then there's also the long haulers we hear about that have the long-term lung issues and fatigue issues, and there's a multiple of factors that can happen because of this and that continue to plague people well after they've gotten rid of or no longer testing positive for it, right?
Sure. The studies are still out there. We just don't know the long-term effects that it might have on your heart, shortness of breath and lung problems, breathing problems, inflammation of your heart muscle. We just don't know from our members' point of view the long-term effects that it might be. It could be a long-term effect that, that lasts a lifetime. We all know that this job is very dangerous, both physically and mentally. We usually leave this job with some lifelong injuries and illnesses. So, yeah, we just don't know the long-term effects that it's going to have.
Is somebody from your organization or from the individual fire departments, whether it's Annapolis or Anne Arundel County, or is somebody tracking this for your members?
Yes. Everybody that's been either tested positive or exposed to the virus, we're trying to do contact tracing and keeping record of it, obviously because, at first we were using our own sick time to be out of work and to be at home, but now, from the tracking that we've done, we've been able to, the county has been able to, give us back our sick time up to 80 hours per person. So that's helped out a lot. But yeah, contact tracing is going on. It's difficult. You may have someone that come down with a positive test that works at one station, and then they might work at another station and not know that they've actually had their positive until the symptoms start to show, and that could take 5 days. So
yeah, it's tough.
It's difficult. We take our temperature several times a day when we come in the morning, at midday, and later on. We try to keep track on it that way, and we definitely tell people, look, if you're having any kind of signs and symptoms, we need to get you a test. We need to get a test on you. It's been difficult.
How has getting the test gone? Are your members able to get tests ahead of the general public, or are they exposed to the same wait times as the general public is?
We have a health and safety division that does contact tracing, and they also, if someone's having signs or symptoms or they think they might have been exposed, we send someone from the safety division out there to test our people from the fire department.
Okay.
So the tests are available. We're approaching, I think this week, we're getting the rapid test, so that's going to help out a lot. That we'll be administering in the fire department.
Although the rapid test has been shown to be maybe not as conclusive as the longer test.
Right.
Yeah. All right. Not an easy time for any of us. Let's take a short break. We'll be right back on the 1430 Connection. Welcome back to the 1430 Connection. I'm Donna Cole, talking today with Joe Addivinola. He's the president of Anne Arundel County Professional Firefighters, Local 1563. Let's talk about another long-term issue plaguing our firefighters, firefighter-related cancers. And while we've seen much progress being made with safety in firehouses and in gear, I don't think there's yet 2 sets of turnout gear for everybody in your union, is there?
I believe we're just about done with issuing 2 sets of turnout gear for us. Yes.
That's good. That's great news. Yeah.
Yeah. We worked on that for several years. It's as you know, it costs a lot of money. But at the end of the day, to make sure that we're in a safe environment and we're protected from all the exposures that we come in contact with, we do need 2 sets of gear, and we were able to work through that through past negotiations. So.
And here's one thing I know what's missing, but and we know that we saw this recently with the unintentional release of firefighting foam by a vendor at the Fire Training Academy, which flowed into local waters and resulted in fish kill. We know that firefighting foam has high concentrations of PFAs, which are cancer-causing. What's next on the list of to-do to make our local firefighters safer?
Well, I think it's a number of things, Donna. At first, we fought for so many years to get staffing so that we weren't short-handed on an engine, whether we pull up with 2 guys on a fire and a first due engine. We've made that better through the SAFER grant. We're getting 50 positions. We've just added them to several stations. So that helps out a lot, having the staffing. As better equipment evolves in this industry, we have a chief in office now that is looking to keep us safe and look at new things and develop, a relationship with these companies so that we're in a good situation and we have all the equipment needed, whether it be apparatus, protective gear, PP&E. We have to take every precaution. We're learning, as an industry that things we've done in the past, maybe this firefighter foam, maybe not wearing a mask correctly or anything that could have caused cancer in the past. We're just trying to limit our exposures and basically, even after calls now, when we go into a fire and, we have the carcinogens on our equipment, we're changing our gear, we're taking showers, we're taking precautions in that manner, and it's been very helpful, but at the same time, it's a learning curve. You take this job, you think you're indestructible. We're kind of crazy. We go into a burning building when other people are running out. And we're not really thinking about any carcinogens on our gear at the end of the day. We're just looking to make a save and keep the community safe. So it's a learning curve, and I think we're getting there.
I think there's a fine line between what you described as kind of crazy and heroic.
Yeah. There's a lot of dangers involved in our industry and our career. We accept that danger.
So you mentioned, because you brought it up, the SAFER grant and 50 new positions. Do we have enough people in Anne Arundel County firefighters right now, and Annapolis City firefighters right now?
It's gotten a lot better, Donna, to be honest with you. We've been able to add at several stations a third person on an engine. I've talked to you before about NFPA standards on a first arriving engine. You should have a bare minimum of 4. We're working very diligently on getting those numbers up. The past administrations involved in the fire department and county exec, they kind of didn't add staffing. As the community, continues to grow every day, population has grown, we just haven't added staffing to the fire service to make sure that community's safe. Yeah, is it a lot safer right now? Yes, than several years ago. It definitely is. We're getting staffing. We're hiring another 70 people in April. It takes time. We'll be able to staff every engine and truck out there with at least bare minimum of 4 people.
This turned into a political endorsement by your organization because our former county executive, Steve Shue, turned down the SAFER grant. You endorsed County Executive Pittman, correct?
Yeah, in a roundabout way. Like any endorsement, we interview every candidate. We sit down and talk with them, explain all the trials and tribulations that are of concern in our career, in our job, and the community needs. So far, it's been good. Our relationship with the county exec, it's been pretty good. We were able to actually negotiate a decent contract without going to arbitration with him last year. So you need a buy-in from the unions, the chief staff, and the county exec. We all want the same thing. We all want to keep the community safe, but we need definitely resources to make sure that happens. And if it's a money thing, you really can't put a price on someone's life. You got to keep people safe. People are not going to move into Anne Arundel County if they don't think that the resources for public safety are there.
Let's take another short break. We'll be right back on the 1430 Connection. Welcome back to the 1430 Connection. I'm Donna Cole, talking today with Joe Addivinola. He's the president of Anne Arundel County Professional Firefighters, Local 1563. Joe, I know the hockey teams were a big thing with the fire department. That hasn't probably happened, or has that, during the pandemic? And the other teams too, right?
We usually have a hockey game every year, usually around the April time. It happened the last 2 years, but there isn't a whole lot of sports events happening right now. So that's been on hold. A softball tournament that we have, we playing several teams in a tournament from our local in PG County with teams all across the country. That hasn't happened this year. Things are kind of like at standstills as far as sports-wise.
There's also, to these games, a fundraising component to them. So because the games haven't happened, the fundraising component might not have happened either, yes?
Yes, yeah, you're absolutely correct. A lot of goodwill that we do in the community. We're not able to have any social gatherings and stuff like that. It's kind of difficult to raise money and give to a good cause. But
is there some way that people can help through a website?
Yeah, we have our website here. We're a 501(c) charitable organization. You can donate through our website. We disperse it, through either emergency assistance funds for our Widows and Orphans Fund, and we do breast cancer shirts every October, men's health. We're looking to maybe get into something else for a T-shirt campaign, because our chief allows us to wear T-shirts 2 months out of the year. We did pretty good with the breast cancer shirts, even though, we couldn't sell them at certain places because of the social gathering. It's difficult times.
It is definitely difficult times. And the website is annearundelfire.org, then choose community involvement, yes?
That's correct, yes.
Okay. Now, back in you're aside from all the sports not happening and the events not happening where there are donations, your members have still been contributing a heck of a lot to our neighborhoods with either books or Thanksgiving meals.
Yes, this is our 9th year in donating Thanksgiving baskets. We usually give it to Spanish Vernon Park Assistant Network, and it's been organized by one of our chiefs up at training, Chief Mayers. She's been organizing this for 9 years. All our firefighters per shift on every shift at every station donate anywhere from like 10 to 15 items in a basket, along with a $25 gift certificate. We bring them up to training, and Chief Mays brings them over to either SPAN or other organizations that need them. This particular year, SPAN of Vernon Park, they had a lot of donations, so they dispersed them in other locations, some churches, some other organizations. This year we did 243 meals, baskets, which fed 970 people this year. We almost doubled the numbers of last year. And these donations and gift certificates come from our members.
And just to repeat that, because I saw the email thread, thanks to you, Division Chief Lisa Mayers wrote, "Unbelievable, just when I think there is no way we can top last year's donation of 143 meals. You come through with astounding generosity. Our donation this year, drum roll please, 243 meals. Each meal is intended to feed 4 people, which means your generosity will feed over 970 people. Truly amazing." That was her email, yes?
Yes. Pretty incredible. Like I say, she's organized this donation bank from the beginning, and she's done an unbelievable job. She puts emails out. She goes around and collects food. She collects gift certificates. She organizes baskets to different locations. We deliver them, and it's just an amazing feeling that we can do something in the community, because at the end of the day, that's what we're here for, the community, and firefighters in general, we like to do goodwill efforts to our community. We like to give back. We love what we do. We're pretty fortunate to have a job where you meet all kinds of community members from, community people from all over, different walks of life, religions, backgrounds, and we're pretty fortunate for that.
I know the firefighters compete, even if they don't say they compete, with cooking. So which firehouse has the best cooking?
It's really not a firehouse. It's me here at the Union headquarters. I'm the best. I'm the best meatball cooker of all time.
I knew it had to be Italian too.
We have so many great cooks in this fire department at different stations. I mean, I think it's probably one of the prerequisites of being a firefighter. I mean, you gotta have your one meal that you bring to the station. And my meal is
meatballs.
Spaghetti. The meatballs.
Spaghetti. All right. Well, I one of these days when the pandemic ends, I'm going to come out and find you and be the judge of that. Absolutely. The last several years we've done a spaghetti dinner and raised, each dinner we've raised, close to $10,000 to our Widows and Orphans Fund. That's awesome. I've cooked for several hundred people. It's difficult, but it's pretty. I love cooking. I can't help it. I love eating too. Manja, right? Manja. Yeah, manja. So to you and all of your firefighters, please stay safe, and wishing you the happiest of holidays. Thank you for joining me today. Thank you. Thank you, Donna, and thank you for what you do over there at the station and all the people that work with you. We really appreciate you. Thanks. This is the 1430 Connection. We will see you next week.